For many American college students, spending a semester abroad is considered an invaluable learning experience. But fears about the Ebola outbreak have prompted many colleges and universities to restrict student travel to West Africa, where the number of Ebola cases is now pegged at around 10,000. Each year, some 3,000 American college students study abroad in that region, the majority of them in Ghana, which has not reported any cases of Ebola. But about 200 students go to the Ebola-stricken nations of Guinea, Sierra Leone, and Liberia. My first guest cites concerns about Ebola as a factor in the decision to cancel a student trip to Uganda, even though that country has not reported any Ebola cases. Jim Ostro is the Vice President for Academic Affairs at LaSalle College in Newton. Welcome to Greater Boston.
Thank you.
Well, as I mentioned, there were a number of factors that you're considering in canceling this program to Uganda. But what were your concerns about Ebola? I mean, there's a lot, I imagine, that you had to weigh.
Well, let me first say that our decision to not proceed with our trip to Uganda had far less to do with Ebola than more to do with the anti-gay laws that have been prevailing in Uganda. They've been overturned, but there's a good chance they'll come back. But there's still a lot of nasty things happening for the gay community in Uganda. And that was the principal reason we canceled the trip after many discussions. It was a difficult decision. We had town meetings, we had panels, we had lots of feedback pouring in, and in the end, we made the decision that as a college we had to stand with the gay community and make a statement.
But as you were having these panel discussions in town meetings, did concerns about Ebola surface?
Not in the town meetings, but in the end, we had to make a judgment. We had to make a judgment call. And Ebola has not crossed into the borders of Uganda, that's true. But in addition to Ebola, there's a UK terrorism alert for Uganda. And while the principal reason for canceling the trip was definitely the anti-gay laws, we also perceived the possibility that we might have to cancel the trip at the last minute. It's not till May, so we made the judgment call to cancel the trip this year.
All right, to broaden this out a little bit, let me bring in Jennifer Yanko. She's the Executive Director of the West African Research Association at Boston University. Welcome.
Thank you.
You've spent a lot of time in West Africa. You've seen what's happened over the course of the last 6 months as the Ebola crisis has taken hold in this country and internationally. What's your concern about what some people are even calling a hysteria, an unnecessary hysteria, because of the impact that it's having on that region?
Well, I think there is a tendency to paint the region with a very broad brush. The Ebola emergency is really focused in Guinea, Sierra Leone, and Liberia. And although there have been cases in Nigeria, they've been quickly addressed, and now Nigeria is Ebola-free. Senegal had one case, and that was quickly dealt with in terms of identifying contacts, following them, and that Senegal is free of Ebola.
What's going to be the impact? Sorry to interrupt you. What's going to be the impact as a number of universities all across the country now? They're having the discussions like you had at on your campus about whether or not to send students there and under what conditions they're going to send students there. But if the bulk of universities decide not to, what is going to be the impact on those communities?
I can just say that WARA, the West African Research Association, has a big research center in Dakar, Senegal, and we host study abroad programs, and we have 3 regular study abroad programs during the year, and 2 of them have canceled. And they have canceled because of concerns about Ebola. So there is a sense that it's interfering or having an effect on students' programs overseas.
Well, and I guess what I'm asking is what impact do the students have? Because presumably they're going on some humanitarian aid trips, and they do have an impact when they're working in these countries. So what happens when they're not there?
Well, it's a good question. I mean, our trip goes to the village of Bumwal-Ukani. We work with children and teachers, primarily focusing on English and math and science to help middle school kids.
And we're looking at your picture. These are pictures
prepare
from
for
your
their high school exams. We also do girls' self-esteem groups, so it's been great work, and the students come back transformed, and they have wonderful experiences there. So we are really sorry to have to cancel this trip. Again, the main reason was not Ebola. The main reason really was the anti-gay sentiment currently in the country.
And the study abroad programs that are operating in Dakar also have very strong internship programs. a component. So that is something that's lost, that kind of exchange.
As you see these other college campuses take up this issue and weigh what kind of scenario they want to put their students into, what do you encourage them to be looking at? I mean, should they be looking at State Department guidelines, CDC guidelines, or just going with their own gut?
Well, I think they need to look at all the guidelines. They do need to look at the State Department. They do need to look at the CDC, and then they need to look at the individual country, what they're doing. But, for example, programs in Senegal are not being impacted by Ebola. So it's this larger sort of fear of the whole region, thinking of West Africa as a country rather than a number of different countries that have different issues. But it's also impacting the region in other ways. For example, at our center in Dakar, we do the collecting for the Library of Congress in 11 West African countries, and we've had to suspend operations in Sierra Leone and Guinea, which were 2 of the 11 countries, partly because of transportation problems, because now you can't get things across borders. There are restrictions in that way. So it's affecting the region in larger ways than simply the direct results of the epidemic.
You've been at pains to point out that in Uganda, which again, as we point out, is not an Ebola-afflicted nation, that it was really about the political occurrences there. But as you both look at this, do you feel that the media coverage has gone overboard, that there is sort of a hysteria, or is it warranted to be this widely careful at this point?
In my view, I think it's prudent to be careful. I think the media's gone overboard, in my personal opinion.
I agree entirely, on both counts.
And how are you looking at what's happening here as well? Because this is the other issue. There's so much transactions that happen at college campuses here, with guests coming. Syracuse University just disinvited a journalist who had come from a West African nation. So with so much travel happening within college campuses here, is that something that you think that college campuses should be more conscious of as well?
I think it's the responsibility of higher education to be cautious and prudent with regard to the safety of their students, but also to take a stand against racism and discrimination. There was a wonderful radio program on GBH today about the discrimination that Liberians have felt in this country, being treated as viruses rather than people. It seems to me it's higher education that has to take a stand against that kind of hysteria.
I would agree entirely. I think there is a tendency to plug into existing stereotypes and really reinforce them with some of the coverage that we've seen, rather than celebrating the successes, the medical and public health successes in some of the countries in the area, even focusing on the emergencies. Both are important, but to only focus on the emergency and to only focus on the magnitude of the problem rather than some of the solutions, I think is feeding into pre-existing ideas about West Africa that would be better left aside.
All right, well, Jennifer Yanko, Jim Ostro, thank you both for joining us. We
appreciate it.
Thank you.